Hello everyone, I'm Navid Zadeh from Rose Clinic Performance Physiotherapy, and my colleague.
I'm Kyle, I'm one of the physiotherapists at Rose Clinic.
Okay, thank you for watching this video. This video is mostly aimed for our physiotherapy colleagues, but however it would be very useful for you as a patient as well, because we're going to talk about initial physiotherapy consultation or assessment, and it's more educational video for physiotherapists, but as a patient you would know what you're going to be expecting when you see a physiotherapist. So the initial consultation is very important session for us and for the patient, because we need to assess and come up with diagnosis if possible. Now, what is assessment and consultation? It means that someone comes with an unknown condition to us, and we don't know anything about this person or patient. Through a systematic process which called assessment, we're going to identify what the problem is, what the root cause of the problem is, and if possible we end up with diagnosis. Now, in order to do this properly, on top of what you have learned in university, you need to practice, you need to observe to get to the bottom of this process, because it's the most important part in physiotherapy. Now, the first part of the assessment called subjective assessment, which you're gonna get the history of the patient and history of injury, how this has happened, all other circumstances that end up with that condition or injuries. Now, during this process, you will identify the type of the pain, the location of the pain, because for instance, if the pain is sharp, indicate towards ligament or cartilage. If it's dull ache, it might indicate to muscle, and etc. And also you need to identify any red flag, for instance, if there is any fracture, any tumor, any other underlying condition. So it's more kind of specific pattern that you follow to get to the result. So after identifying the location of the pain, the type of the pain, if the pain is radiating down or up, if the pain is radiculopathy, or if it's just muscular ache, if it's joint pain, it's joint dysfunction, you name it. Then you're going to look at the function of that region or body part. Because one of the difference between physiotherapy assessment and other professions, for instance, orthopedic assessment, is that they look at the pathology only. But we have to consider patients' daily activities, how they live, where they live, if this issue is going to affect their work, if they're going to affect their sport. So that's why the physiotherapy assessment is kind of more comprehensive than other assessment. So after you identify the first part of the history and pain, and the type of the pain, location of the pain, and effect of this pain on the body or region and the work on the physical activity, then you narrow your data. While you ask this question, you analyze at the same time those data that you receive, those answers that someone gives to you. They do matter. Based on these answers and those information that you receive, you narrow your way towards differential diagnosis. That's where you say, okay, someone comes with a knee pain, it doesn't look like a fracture, it doesn't look like a muscular pain, it doesn't look like arthritis, so we remain with either medial collateral ligament or medial meniscus. So that's kind of example for differential diagnosis. Instead of doing test for whole knee tissues, you narrow your ways and end up with 1 or 2 or 3 conditions, and then you're gonna do the objective test, which start with the proper observation. You're gonna observe the entire lower extremity, mostly for lower limb injury, and upper extremity, and perhaps whole body for back pain or neck shoulder. Either is the body symmetric, or have someone leg discrepancy, arch of the foot, O knee, X knee, is the arch of the spine, hyperkyphosis, hyperlordosis, forward head posture. So all of this will be observed, and then you do some orthopedic tests to identify the problem. So based on the information you gather during the initial phase, which is subjective assessment, you analyze them and then do certain tests to confirm your finding. Once you got there, then you have done the most of the job, and then you tell the client, okay, that's what I believe is happening. You might not be able to get to conclusion because you might need MRI or you might need a blood test, you name it. And then if needed, you refer the patient to a specialist or GP that further investigation will be conducted. And also, if a patient attends to you with MRI or some other report, try to not look at them first because they're going to bias your assessment. So I usually took them aside, finish my process, and then see if I'm in the same line as those reports I've confirmed. Once you finish this, based on your finding, then you set up treatment plan. Treatment plan basically can be two parts. One is short term and the other one is long term. Usually with short term, you look at pain reduction, improving mobility, flexibility, and other important situations such as someone live in the house with the stairs, how you can manage that, and other activities such as work and sport. And in long term, you try to achieve patient's objective. Someone want to get back to running. Someone want to go work 10 hours as a driver. So based on people's objective, you set up your long-term plan, and through your rehab, you achieve that as well. Okay, thank you very much for watching this video. If you have any question or any concern, please do contact us via our social media or our website, which is www.roseclinicphysio.co.uk. And please feel free to attend our practice for second opinion, which will do quite help a lot of people in this matter as well. Have a good day. Until next time, all the best.